Late Life is a production of Twin Cities Public Television in partnership with Allina Health, whose Life Course project, funded by the Robina Foundation, granted the producers unique access to their ongoing research into late life care in Minnesota.
The number one question asked by the general public is, what is the difference between dementia and Alzheimer's disease? Dementia is a word that describes a set of symptoms, but it's not a disease in and of itself. Dementia is caused by many diseases. Alzheimer's disease is the leading cause of dementia.
We'd go over to visit her, and I would just notice the small little things, like the repeating in that. And I remember bringing it to Don's attention, just saying, we got to start thinking about something with your mom.
Age is the greatest risk factor for Alzheimer's disease. Currently, about 10,000 people a day turn 65 in the United States, and that is expected to happen for the next 20 years.
It's almost as if I am the adult and she's the child, like it was when I was a kid, and I'm sure she had to do the same thing for me.
About 1 in 10 people at the age of 65 develop Alzheimer's disease. That number increases to about 1 in 3 once people reach the age of 85. So we're witnessing a veritable tsunami of Alzheimer's disease and related disorder cases.
I don't have no idea what's gonna happen. I don't wanna know. I don't wanna know the worst.
Alzheimer's disease is a chronic disease. It's a fatal disease, but it's a very slow, progressive illness.
We know what the future will hold. It's just a matter of embracing every moment.
I really don't know what's going to happen tomorrow or next month or next year. My mantra in a way is live in this moment, do the best you can today, and not worry about tomorrow.
While it's very scary when people get a diagnosis, I think it's very important for people to have hope and to realize that it is possible to live well with Alzheimer's disease.
We are so blessed, so thrilled, and so excited to be residents of Allina.
To prepare for the increase in Alzheimer's cases, communities across Minnesota are leading the way in becoming dementia-friendly. Allina is one of 34 communities so far who've taken a pledge to provide a welcoming place to live.
We are here to tell you there is life after a diagnosis of Alzheimer's. The years before, as well as the first year after Ken's diagnosis, were not easy.
This was the Act on Alzheimer's Allina community meeting to report kind of the work that we had done in 2014, trying to make Allina more dementia-friendly.
Our daughter asked, "Mom, I'm just really having a hard time with Dad's diagnosis. I really would ask that we just not talk about it."
First priority is learn about the disease and what you can do if you're interacting with a person with the disease or reaching out to a caregiver.
We went to our Episcopal church not too far away, but of course we didn't tell anyone yet. We didn't want their reaction to be the same as our daughter's.
Alzheimer's disease is very isolating. Many people don't know how to react. They want to help, but they're not sure how. The best things they can do for their neighbor, for their friend, is to continue to interact, to be patient, to be kind, to be welcoming, to continue to invite.
We were really experiencing the lowest of emotions with the disease, but we met a wonderful care consultant, and we were able to turn our despair and depression to truly one of hope and acceptance of the disease.
So I think what will come out, hopefully flower in 2015, will be all the different ways as we all become aware how we can reach out to caregivers and people with the disease.
It is through God's loving grace, our loving support of children, and the Alzheimer's Association that Ken and I made the decision and the commitment to work together to make a difference for others living with Alzheimer's.
It's something that we needed And if we can give back in any way, I think that that's where we are, all walking together through this.
One way Mary, Margaret, and Ken walk alongside others with Alzheimer's and dementia is through singing with a Giving Voice chorus.
Marge and I come from different experiences. I have Alzheimer's background, working in the field for 10 years. Marge had arts production, and we sat down one day, I think we said, it wouldn't be great to work together, to do something together, bring arts and Alzheimer's together.
We put together an advisory group so that we weren't doing this in a vacuum. That was the most important thing. Let's benefit from work and knowledge that other people have. And that's what made all the difference. The choir is made up of many varied individuals. So we have people in their 50s, 60s, 70s, and 80s. We have people who have many different diagnoses of early stage onset. We have people with Alzheimer's. We have people who have many other things that are mixed in together. We have volunteers. So you look at the group and you actually don't know necessarily who is who.
There's such a diverse group of people, background-wise, but we're all having a good time.
We would see these people become who they were before Alzheimer's. They were no longer people with Alzheimer's and their caregivers. They were singers. They were human beings first, and down the road, a couple places later, they were people with Alzheimer's.
And I think you are witnessing some magical things that happen to people when they become engaged. People who even have later mid-stage disease able to sing.
Doris has a form of dementia called primary progressive aphasia. The symptoms, instead of being like memory loss, like in what you traditionally think of with dementia, is with her speech. We wasn't sure how it would go at first, but we managed, So some of the songs that we've sung, I'm not sure if she knows them or not, so together we're trying to figure it out. It's kind of a doing it together kind of a thing.
Without her, I'd be gone.
Not true, but we do have a lot of fun.
So when I see Annie and Doris together, and I know that Doris is not talking much at all, and I know that Doris is singing, when I look and see the joy every week,
the tears flow. Because they're singing these words together, they're kind of getting close to each other. They're sharing something that goes beyond a conversation, beyond regular kinds of communication. They're communicating through music.
Many people who are further along than I am start to have more difficulty, and it becomes harder for them to socialize.
The community aspect of the choir has been very, very important, and we planned on that because one of the things that people here have said is that when their loved one has a diagnosis, sometimes people kind of back away. People don't understand this disease.
But when they are in the choir environment, they get tremendous support from the other people, other than caregivers, just other people with Alzheimer's. There's no judgment. Everybody's there and having a good time, and we're all the same, and Alzheimer's is really not in the picture there.
They have said when they come here, they are social people, and they love it because they're socializing with people who understand what's going on in their lives. And isn't that what we all want? We want that kind of freedom to be with people who care about us and who accept us for who we are. The joy that comes from people with dementia and Alzheimer's when they are put in an environment to thrive is infectious.
Do you want to listen to your music, Barb?
Sure.
The act of listening to music can bring joy. To help people live in the moment, Walker Methodist Health Center uses simple, everyday technology.
This is the memory care unit. So our residents here are experiencing music individually on top of all the other music that we do. This is just something, an addition that we add to our program.
I think it just makes her even happier than she normally is. She is typically happy, but she loves to sing, she loves to dance. You want to dance for me?
When we first started it, we didn't really know what to expect.
How about some music?
That sounds good.
Loud enough?
And when we first put the iPods on the residents, it just completely changes.
I don't need no doctor.
Someone with Alzheimer's disease or some sort of dementia, music is the last thing to go. They'll remember the words to a song where they can't remember what they had for breakfast or for lunch, but those words will last, and that brings back memories for them. It's just something in the brain.
When music and memory came on board, just seeing the smiles on their faces, it's totally different. Having the music to their ears and the memories that elicits. There's moments where if there's a particular music playing, they'll be able to pick up a memory and be able to say, oh, that was lovely. Those are the good days for us.
Yeah. Different reactions for different people. Some people will relax more.
I'm looking over a four-leaf clover.
Oh, there's your man to dance with. And some will get up and dance and enjoy the music that way. Younger, if you were a little younger.
Yeah. Oh.
So they all enjoy it very differently, but we've seen positive benefits with almost all. And then you see them interacting together, where it's not isolating them as you would think, having their own personalized music on. It's actually bringing them together and making them interact more. This program has done more for our residents than I ever thought it would. Our hope is that every single nursing home in the United States has this program because it has been so beneficial and just so neat to watch.
Thank you for the memory, see?
Culturally specific care has emerged as an unmet need. Centro is one of the social service organizations in Minneapolis tending to the needs of the Latino community.
Centro Tyrone Guzman promotes the well-being and full participation of Latinos and Latinas through education and family engagement.
Dora and Dolores are two of our seniors that have been here for about 4 years now. Dora is the daughter of Dolores, and she's actually also her PCA. Doña Dolores was diagnosed with Alzheimer's, and so Doña Dora comes here to get support, giving her a small break and helping her watch out for her mom.
Si she be in medication, she gets better. Not that better, but not like before, because before she me pegaba, she beat me.
Most of the time when we say dementia, it's translated into a form of craziness, which is a very strong word. And we really want to try to educate our community more about what dementia is.
She ran away, like I closed my eyes, and where is my mom? And sometimes she got lost. I have to watch her 24 hours. In my house, I have to have a special lock.
It's really hard for them coming to this country, not knowing the language, not knowing the system, not being able to be independent how they were in their countries. People that speak their language that are able to help them, that extra support definitely helps. ¿Usted sabe cómo demencia va progresando lo que viene
Sí, va a
después?
progresar, sí.
Yes, it's gonna progress.
Yes.
¿Qué cree que es lo siguiente?
She started to forget how to eat. She started to forget how to go to the bathroom. Sometimes I put her diapers because in the mornings she's wet. And then sometimes I do help her to take a shower because she don't know how. She don't know how because she forgot. And she's smart because sometimes she remembers and she says, I remember when I used to taking care of you, now you're taking care of me. She likes to be here. When she's here, she's happy and she just remembers what's going on in this moment.
Being diagnosed with dementia, it can be scary and confusing. We are able to guide them in their language and understanding the culture through this situation. We as Latinos, we are more likely to develop Alzheimer's than other races. So there is a huge need to have more resources in Spanish. We are working really hard to improve those resources because our community needs them.
Coming here definitely helps to feel part of a community, and again, it reduces that depression and isolation that they have been feeling.
If I see her happy, so I'm happy. That's the reason and most important for me, for her to be happy.
Who is that?
That's my mother.
That's your mother.
Carlton Garner moved his mother, Marie, from Alabama to care for her in his St. Paul home. He manages the mounting responsibility by arranging for Marie to receive both in-home and adult day services while he continues to work and take care of himself.
Actually, she's doing quite well, considering the disease itself. But she has regressed. I have to give more commands of what it is I need her to do. I have to stand over her to make sure that she gets it done. Just not able to remember the basic things that you and I take for granted.
So when people know that there's a brain disease behind the symptoms that they're seeing, they have an explanation for the symptoms that they're seeing in their day-to-day life. And it also opens the door for them to seek help.
The disease is what it is, and I can't change it, but I can change how I approach her. So I'm more patient. I'm her voice. I'm her eyes. I make sure that she's safe and she gets everything that she needs.
There's no right or wrong way to take care of someone with Alzheimer's disease if you're patient, kind, and supportive of that person's needs.
It's something that I enjoy. This is an opportunity for me to give back to her, even though it's difficult. I have a full day, I have to work, and then my job doesn't end when I come home.
Caregivers need time for themselves, even just to go to the grocery or take a shower. There are many ways to be able to do that. There are home care services where people can come into the home. There are adult day services, which is a place where people with dementia can go. And we think of this as a break for the caregiver, but honestly, it's a real treat for the person with the disease as well, because they can interact with other people, be engaged, do activities.
We're on our way to the Wilder Foundation. You know where you go and you see all of your friends and you all eat and play games and read. You remember that?
I passed that stage.
No, you haven't. That's what you're going to do now.
I could have stayed at home today.
No. When you get here, you always have a good time.
How long are you going to be gone?
Oh, about 3 hours or so. You won't even miss us.
We see our program as not just for participants. This is a program for caregivers. For Carlton, it's important for her to be here. He still works. And also, he can do what he needs to do during the day while his mom is at the program. And the satisfaction to know that she is well cared for.
And talk to her.
We hear that all the time. One-on-one is great. Right. Just get her face to you.
It allows me a form of respite, knowing that she's in a safe environment.
Respite is just another word for relief or taking a break, and pretty much anyone who's raised a small child, the 24/7 issue, can understand that every now and then, to keep that going in a loving and supportive way, you need a break yourself.
But it's a difficult thing to do. The focus is on the well-being of the person who is sick, and that is normal, and that is okay. But we see a lot of caregivers pass away before the person with dementia because they're not attuned to their own health and well-being. This is a marathon and not a sprint. And if you don't take care of yourself, you won't be there to take care of your loved one with Alzheimer's disease.
So what do you think these are? Cucumbers?
Bell peppers.
Bell peppers?
It allows her to interact with people around her age. It also gives her a chance to continue to have some of the personality that she had. She always enjoyed helping people. She gets around pretty well. She still has incredible manners as it comes to dealing with people. So this gives her an opportunity to continue to use those skills.
With Marie, what we see in her is that we can meet her where she's at, meaning that we will provide the opportunities for her to be successful. So we know Marie loves to read, and she can still read, so we'll give that an opportunity for her while she's here.
Can you read them out loud for us?
Yeah.
Okay.
You can't be a hero without taking chances.
We know she likes to do exercise. She loves a gross motor kind of skill. She loves to dance.
Bring it up high, Marie. There you go.
So those are things that we know about her, which is also very important, that we know their past a little bit and that we know their likes, and then we can really work for them to be successful.
It helps me because I know that she's having a good time, she's safe, and it's an outlet that keeps her going. So it's a blessing.
We did exercises, we went for a walk, she was dancing, she played.
I want people to know they aren't alone. This is a tough situation, and most families struggle because working and trying to keep them safe and keep them comfortable and smiling, that's not easy. She said she'll see you next week, okay?
I'll see you next week.
See you tomorrow.
Sure. Okay.
But she is my mom, and I wouldn't trade this position with anyone else because I'm having an opportunity to give back.
You can go see Grandma? Want to come see Grandma? Come on.
Ruth Stoops' Alzheimer's disease had progressed to the point where her son Don and daughter-in-law Barb could no longer care for her in their home. Ruth has spent 8 years living in a nearby memory care facility.
Hopefully she's in a good mood and things are on the upside for her today.
See Grandma? Should go see Grandma? Looking good today, Mom.
Thank you.
Looking good.
Yeah, this is kind of cool for us to see her like this.
And why is it cool for you
Well,
to see her
because
like this?
it's like the Ruth that I would remember before she became sick.
I was looking for you this morning, and you were in the beauty shop.
Oh.
So.
What were they doing?
Washing your hair, curling it.
One of the bad things I think about this is in these later stages, she doesn't remember from 2 minutes to the next 2 minutes. And as people visiting, I just block it out as part of the disease.
She'll have no memory whatsoever that I was there yesterday and helped her pick out what she's going to wear and that we're coming, unless they've told her right before we come. And she might remember. She always liked Christmas.
Yeah.
You could talk about Christmas.
I like that even as a kid.
What do you remember from back then, Mom?
Nothing.
I've learned that, as with anything, there's going to be good days and bad days.
A good day is that they're not agitated or sad for any reason, that they're smiling. Some residents dance, sing.
The good days, she's smiling. She's out being involved with recreation, whether it be calisthenics or music or the things that, they want the residents to be involved with. Those are the good days.
Bad day is when I come sometimes after work and you probably don't even know I'm here because you're like laying on the bed and I might go like this and go, oh, you go, leave me alone. And I sit there for a little bit, but then I just leave.
Yeah.
I've learned that on certain days her personality is totally different. Like Ruth was never an angry person. Some days she can be angry and she'll do things that she never used to do.
Get me out of here. Dad? Get me out of here, away from her. She's an ugly person. I know, but I just...
Okay, aggressive. My mother never was like that. She was never an aggressive person. There's a part when she does, that's the bad days.
You got to kind of go with how it's going for that particular day. Here, I just thought of another, could tell a good day. She hasn't asked the same question. You know how sometimes you ask the same question like literally 4 or 5 times. She hasn't done that. This is a good day,
I know she's not going to regain her memory. Hopefully nothing else goes wrong, okay? If nothing else goes wrong and she just progresses with the Alzheimer's and passes away peacefully and painlessly as could be expected, that's my hope. I hope that happens.
Say cheese.
Cheese.
I have no problem admitting that I probably will develop it. I have no problem with that at all. Am I scared of it? I guess kind of, but maybe I won't. Maybe I won't, but I got a sneaky suspicion.
Oh, I think about it. I know that someday, the odds are that he's going to get it. So, but I think I'm much more prepared than when Ruth got
I've learned an awful lot.
She just wants to eat the candy.
Working with people with Alzheimer's disease has taught me so many things. Perhaps one of the greatest gifts that this work has given me is the understanding of the importance of living in the moment. As the disease progresses, the past becomes fuzzy. The future is not something that people think about. It's all about right now. And what I've learned from working with people is, what can you do to make right now a great moment? And that's a great lesson for working with people with Alzheimer's disease, but it's also a great lesson for how we live our own lives.
Late Life is a production of Twin Cities Public Television in partnership with Allina Health, whose Life Course project, funded by the Robina Foundation, granted the producers unique access to their ongoing research into late life care in Minnesota.